And hello, everyone. We are back. Thank you so much to our last panelist and our moderator for a truly engaging and important conversation. And many thanks to you all for remaining with us, as I know it has been a full day of robust discussion already. And we are excited to report that there is still more to share. So before I introduce our final panel for the day, I'd like to remind you all again, if you haven't already, to please contribute to today's discussion by filling out our survey that is pinned at the top of the Slido chat so that we can capture your needs as we seek to build out a research agenda that is relevant to your work. So our next theme will share innovative research and data methodologies to address climate impacts on health. This last discussion will be moderated by Dr. Zulfiqar Bhutta. Dr. Zulfiqar Bhutta is the Robert Harding Inaugural Chair in Global Health at the Hospital for Sick Children in Toronto, co-director of the Sick Kids Center for Global Child Health, and the founding director of the Center of Excellence in Women and Child Health at the Aga Khan University. He also holds adjunct professorships at several leading universities globally, including the School of Public Health at Johns Hopkins, Tufts University, University of Alberta, as well as the London School of Hygiene and Tropical Medicine. He is a designated distinguished national professor of the government of Pakistan and was the founding chair of the National Research Ethics Committee of the government of Pakistan. Many thanks to you for joining us today, Dr. Zulfi, and I will turn it over to you to introduce our panelists.
Well, thank you very much, Renee, and thank you to the National Academy of Medicine for this opportunity to join you today. My task as moderator is to make sure that we hear our fantastic panel, and starting with none other than Chris Murray. And Professor Christopher Murray is the founding director of the Institute of Health Metrics and Evaluation and the chair of Health Data Metrics at the University of Washington in Seattle. Dr. Murray is the founder of the Global Burden of Disease and has held many important international positions, including being the Assistant Director General of Health at the World Health Organization, first introducing the GBD concept to the world. And of late, he has played a sentinel role in the US in terms of monitoring and projections for COVID-19 during the pandemic. So Chris, the floor is yours.
Thank you very much, Zulfi, and it's a great pleasure to participate in this panel. What I'd like to do is take the 10 minutes to just talk about some of the efforts that we have ongoing at the Institute for Health Metrics and Evaluation, and more broadly under the GBD umbrella, to more fully take into consideration all the different pathways through which health may be affected in the future through climate. We will be publishing, I guess, in about 3 weeks in the Lancet, forecasts of the burden of just out to 2050 that are climate sensitive as part of the GBD 2021 release. But we have planned, and our target is to be ready for COP29, a much more comprehensive view of the different pathways that may be influenced. So we've done the direct temperature relationships, that's already coming out. We've included in what's being published the PM 2.5 reductions associated with reductions in greenhouse gases. I will show you in a moment some of the work on food security, plus minus the migration part, which is really not that developed. And then malaria, dengue, extreme weather events, and wildfires are things that we're working on and are coming, but certainly not at a point where I can show you results. Next slide, please. As part of the GBD, a few years ago, we took all the available data that was both cause of death data that was both available by day and for which we had cause of death. And that was for, unfortunately, only about 12 countries in the world. But we used that data to come up with risk curves for a number of causes that were convincingly related to daily temperature. And those risk curves do vary by what your annual temperature is. So think of a big U, cold is bad, heat is bad. And the bottom of that U-shaped curve shifts as you live in a warmer place. And that was published a few years back and then became incorporated into the GBD And then that sets us up to use that information to forecast direct effects of temperature into the future. And that's what's going to be published in the Lancet in the near future. Next slide. Now, the interesting thing in what we will publish out to 2050 and out to the end of the century is very different, as we'll talk about in a moment. But out to 2050, the story that we're about to talk about is still generally optimistic. We see life expectancy still increasing, despite lots of challenges out there. This is what the past up to the dashed line and the forecasts that are about to be published. And the lines are for females in the top left, males in the top right, and what in the GBD parlance are called super regions, large aggregations of countries, where you can see that not only is there going to be some increase in life expectancy in our models in the reference scenario, but some of those huge disparities that exist will narrow a little bit. On the bottom panel is healthy life expectancy, and that's a little bit less positive in the sense that we see almost no progress in many regions in gains in healthy life expectancy. And in some cases, for example, high-income countries, there may actually be a slight decline as things like drug use, depression, anxiety, and some other disorders, the prevalence will increase so that the gap between life expectancy and healthy life expectancy may increase. Now, we've built in the direct effects of temperature and the benefits of reduced PM2.5 exposure if you have a scenario where you can reduce greenhouse gases into these scenarios. Next slide. Now, to go farther, particularly to address food security, we've had to, which we think is probably the most important climate impact, at least in the numbers that we're seeing. We've started an effort where we have partnered with the AI for Good lab at Microsoft and the satellite company Planet in order to get much more precise mapping of where people live so that we can then translate that into who's going to be at risk for food insecurity, childhood malnutrition, turns out also, adult low BMI and the like. So this precision mapping exercise is something that we plan to start releasing the results to the world sometime during the course of the year. Next slide. And here's just an illustration of that exercise. This is for one particular location in the north of Ethiopia. There's a famine in this area, not necessarily in the town of Mekelle, but you can see on the right, on the left is what we get from the satellite imagery and advanced machine learning, which is a reasonably precise view of where there are human structures. And then combining that with household survey data and census data, we're able to put people in those structures at a pretty fine detail. These are 30 meter by 30 meter pixels, and that's what we see, and we have done this for the planet. Next slide. And also by time period. Now you can use that information and replicate a very interesting analysis published in PNAS about 5 years ago about what is the historic human niche, but we can now do that country by country. Where have humans lived in each location as a function of ecological variables? Rain on the x-axis, mean annual temperature on the y-axis. Arguably, days over 30 degrees Celsius, day-night average is probably a better measure, but we'll talk about that. And this is an occupancy rate. This one is for Ethiopia. What fraction of 30 by 30 meter squares classified by rain and annual temperature, what fraction of those have some evidence of people living there? And some, in gray, there's no one. And some have very low occupancy rates in the blue colors of 1 in 1,000 of those pixels have some presence of humans, which suggests that people really prefer the yellow areas, moderate rainfall, moderate day-night annual temperature. Next slide. Now, what we found out, which I think it makes a lot of intuitive sense, but it's really quite spectacular, the results, is when we take all the DHS data and all the mixed data that's been geocoded and assign each household where you've measured child malnutrition to these ecological variables. On the x-axis, it's days over 30 degrees Celsius. we can then say, well, is there a relationship between those variables and wasting and stunting? And this is for wasting, which is the most strongly related. And just as a control variable, we have household income on the y-axis. Regardless of household income, if you are in a place that has more than 21 days over 30 degrees Celsius, then you are at a very high rate of wasting. And so you can go as low as 4% if you're top decile, no days over 30 degrees, and you're up into the 20s for those that have more than 21 days a year. So very strong relationship, and which then tells us that we should expect as the Earth warms, and particularly those places on the edge of having many days over 30 degrees Celsius, we're going to see a doubling, a tripling, or a quadrupling of childhood wasting in those places. Next slide. So we've done a simulation analysis for Kenya. Top panel is RCP 4.5 SSP2, where we've looked at how many people will be pushed over into very heat-stressed environments that have that very high level of childhood wasting, and it turns out stunting. And for that turns out to be about 11 million by the end of the century in Kenya, in this example. And then on the bottom panels for RCP 8.5, SSP5, where that's a much larger number. And you could have as many as 38 million people living in those heat-stressed environments, given that fertility rates, paradoxically, are highest currently in the places that are likely to be the most heat-stressed. And that's a generally true observation throughout the Sahel and even parts of South Asia, where we see much lower fertility on average, but still there is this gradient that the most at risk of heat stress are also those where population is growing the most. The wild card on the research agenda, which is the one that we think is one of the most important things for everybody to be thinking about and trying to come up with strategies to understand, is there are these environments that will be highly heat stressed. We've been focused right now on food insecurity, but we're also looking at flooding, and you can map where those are. Will people stay in those environments or will they migrate out? And of course, the answer is both. Some will stay and many will migrate out. And it's the understanding the drivers of migration that will really make a huge difference to the actual magnitude in the future of this particular pathway around food security, but likewise around those at risk of flooding. So those are some of the themes that we wanted to emphasize on our sort of very whirlwind view of what are the different pathways that climate may operate through. Some of the others, probably quantitatively much smaller than you'd think, and I would include in that malaria, dengue, extreme weather events, and wildfires, definitely real impacts, but not of the same magnitude of either the direct effects of temperature or this huge pathway through both food insecurity, migration, and the knock-on effects of migration in terms of health system stress, even political and social stress. So thank you.
Well, thank you very much, Chris, for that rich and fascinating presentation. I'm sure there'll be a ton of questions around what the implications are of this data. Well, we now move forward to our next presenter, who is Professor Tracey Holloway, who is the Jeff Rudd and Jean Bissell Professor of Energy Analysis and Policy at the University of Wisconsin-Madison, and with a joint appointment at the Nelson Institute for Environmental Studies and the Department of Atmospheric and Ocean Sciences. She's been highly recognized as an important contributor to the entire science agenda in climate change. She is a recipient of the Ascent Award from the American Geophysical Union Atmospheric Sciences section, and she has served as a two-time leader of the NASA Health and Air Quality Applied Sciences team, which connects the NASA data with stakeholder interests in this area. So without further ado, Professor Holloway, the floor is yours.
Thank you so much for that kind introduction. And it's really a pleasure to be part of this panel this afternoon. I'm going to be zooming in on the United States and also zooming in on the topic of air quality, both of which were kind of subtopics of Dr. Murray's presentation. And even though I'll be talking about the US, I think many of these issues relate to equity around the world, where air quality is a major connection between climate and health outcomes. And it's a connection for a few reasons. First, as the climate warms, the weather conditions that promote ozone formation, wildfires and smoke, drier lands and dust can worsen the exposure of populations to air quality. But it also connects these because the solutions to climate change almost always lead to cleaner air. So when we're thinking about the benefits of moving away from fossil fuels, the benefits to the climate are spread out globally and spread out in time. But the benefits to air quality are almost immediate and localized to where the reductions took place. Next slide, please. So when we're thinking about equity of air quality exposure and who is going to benefit from solutions and who's currently suffering from unhealthy air, the term we use for that in the United States is environmental justice. And we really can't talk about environmental justice without citing back to the work of Dr. Robert Bullard, who in 1983 published a study that showed that waste sites, garbage incinerators and landfills in Houston were consistently located in Black neighborhoods. And building on this work, he's since often referred to as the father of environmental justice. And so really all of this work is within this scholarly context of environmental justice. But applying and analyzing the environmental justice of air quality is often limited by the availability of data. And in the United States, we have thousands of publicly available monitors, but we still don't have enough. And that problem is exacerbated in other countries, some of which have no air pollution monitors with available data. Next slide, please. So in the United States, the history of our urban growth is tied fundamentally to a concept called redlining. And the idea with redlining is that after World War II, the federal government identified neighborhoods and cities that were eligible for federal loans for building homes and neighborhoods that were considered too risky to be eligible for federal loans. And they issued these maps, and there's maps like this for every US city, and the University of Richmond has inventoried them in a nice website linked below. Where the red neighborhoods were the Black and minority neighborhoods at the time. And because these were colored red on these federal maps, redlined as it's called, then they were not eligible for increased investment. So as a result, they became less desirable neighborhoods, and they often became the site of large factories and other kinds of infrastructure associated with poor air quality. So today, when we think about who's breathing the unhealthy air in which neighborhoods, part of this has historic roots and is not just coincidental about the cost of land or the cost of housing, but really is structural with deliberate racist roots. Next slide. So a study in 2011 was the first to look across the United States using monitoring data to say who is breathing unhealthy air. And at the time, the focus was on ozone and PM 2.5, the study by Miranda et al. And it's a very nice study. They only focus on the monitors that have counties, which in the US is about a third of all counties. And even within a county to have a single monitor, okay, that's good, we're on the map. But that misses all the structure that happens neighborhood to neighborhood. For example, I showed you a map of Chicago on the last slide where you saw the red and the yellow and the blue and the green. Well, here in Chicago is one example where that's all in a single county. So while this first study did a great job looking at the whole US, looking at monitors, not only is it missing 2/3 of the spatial area, but it's also missing the structure within the counties. Next slide, please. So one way to start filling in the gaps between what's available with monitors is to look at computer models. And my students and I did a study. This was published 2 years ago in Environmental Research Letters, where we looked at different solutions to decarbonization applied to different sectors. And we looked at how different populations would experience the benefits of different decarbonized scenarios. And we considered, what if we had zero emitting transportation, and that's in the lower left panel, or zero emitting electricity, and that's in the upper right panel, or zero emitting industry, and that's also in the upper right panel. And I could go through all of the results, but we only have 10 minutes. So I really want to just zoom in on a more qualitative heuristic here in the lower right panel. This is a map from the US Census Bureau that shows the dominant minority in different parts of the US. And so the blue represents Black and African American counties where Black and African American populations are higher than usual. And you see that those counties where that's the dominant minority are primarily impacted by decarbonized industry in the upper left panel. And so this idea of thinking about who's going to be affected by improvements is the flip side to who's already being affected today. Next slide, please. So if we want to be looking within urban areas, again, computer models are a way to be zooming in, but we need high enough resolution to be discerning neighborhood to neighborhood scales. And the only model that's available today that allows coverage of a wide area, whether it's the US or even the globe, and zooming in on urban areas, is a model called INMAP. And INMAP, INMAP, stands for the Intervention Model of Air Pollution. And it was published, one of the studies was published in 2021, led by Chris Tessum at the University of Illinois, Urbana-Champaign. And it was covered in the New York Times with the statement, "People of color breathe more hazardous air. The sources are everywhere." And this plot here is from the New York Times coverage of this story, which show that for every sector of emissions, when it comes to PM 2.5, Black communities are disproportionately affected. And for almost every sector, white communities are disproportionately protected. The only two sectors that also disproportionately affect white communities are power plants and agriculture, because those tend to be located in more rural areas that have higher white populations. Next slide, please. My group has also used the INMAP model to zoom in on individual cities. And here you're seeing a study that we published zooming in on my hometown here of Madison, Wisconsin. And we were able to use this model to look at how different scenarios of decarbonization would play out at the neighborhood scale. So I'm showing this for here really just to show what this variable grid environmental justice model of INMAP looks like, with larger grid boxes on the in the rural areas getting smaller and smaller down to 1 kilometer. And there is a global version of INMAP as well. Next slide, please. But this is bringing me to the point that there's actually lots of data sources to look at air quality, and they are giving different answers. And so there was a study led by Gage Kerr and others at the George Washington University. And this came out of the NASA team I lead, the NASA Health and Air Quality Applied Sciences team. And they looked at ground-based monitors, that's shown in the upper left panel. They looked at computer model data in the lower left panel. They looked at satellite data in the lower right panel, and a land use regression model that was combining some of these different data sources in the upper right panel. And what they found is actually you identified different levels of equity depending on which data source you looked at. With the most pronounced inequities, the more spatial coverage your data set has, the more you see the inequities in the air pollution exposure. So the lowest level of inequity was from the monitoring data, panel A. So I think this idea that we often consider the monitoring data as the gold standard for air pollution analysis, but because it doesn't have consistent, continuous spatial coverage, it may be missing a large part of the story when it comes to air pollution and equity. Next slide. There was a nice research review article, satellite data for environmental justice. And I think one of the points I'd like to point out here is that when we're thinking about equity, one of the key gaps in the research so far has been partnering with affected communities. And so I think this idea that if we're going to be looking at equity issues for climate, for air quality, we really want to be making sure it's being done in shoulder to shoulder with the communities that can benefit from that work. Next slide, please. If you're interested in satellite data, I'd like to point you toward the website of the NASA Health and Air Quality Applied Sciences team, haycast.org. We have a lot of tools and resources on getting started, tutorials, and more. And most of these data are globally available. Next slide. And for resources beyond just satellite data, my research group has put together a one-stop shop that kind of inventories all of these data for both US and global and other sources. And this is at the hollowaygroup.org/data/models. Next slide. So take-home points is that air quality connects climate change with health and equity from global to neighborhood scales. There's data available from different sources, but they are not always for the same pollutants or timescales or periods. There's a lot of new data coming out, especially exciting new satellite data, a lot of opportunities for engaged scholarship where we can work with affected communities. And really, I see a lot of motivating challenges here to build partnerships and advance scholarship that can have academic rigor and real world relevance. Thank you.
Thank you very much, Dr. Holloway. And this sets us up very nicely for our third speaker for this session, which is Dr. Chinmoy Sarkar. Dr. Sarkar is an assistant professor in the Department of Urban Planning and Design at the Faculty of Architecture at the Hong Kong University. And he is also the inaugural National Academy of Medicine Hong Kong University Fellow in Global Health Leadership. So I want to pass the floor to you, Dr. Sarkar, for your contribution. Thank you.
Thank you, Dr. Bhutta, and I thank the National Academy of Medicine for providing me the opportunity to speak in this very important theme 3. Next slide, please. And next slide, please. Yeah, let me begin by highlighting the complexity of the phenomena. Firstly, the extreme climatic events vary by the type of risks they pose, such as those posed by extreme temperatures, floods, wildfires, droughts, etc. They vary also in terms of their frequency and intensity, and in many instances, they are interrelated with one another. For example, according to Clausius-Clapeyron's equation, it states that air can hold 7% more moisture for every degree of warming. And this means that daily rainfall extremes will scale with this factor. Secondly, extreme climatic events are geographically variable at global, regional, and sub-regional scales. And thirdly, we see disparity in the observed health effects in terms of mortality and diseases. Often, populations not responsible for the greenhouse gas emissions are disproportionately affected. As such, the value of reliable data, scientific study design, and rigorous evidence base becomes more important. There has been a preponderance of ecological studies on the associations between extreme climatic events and health outcomes as what I say the first tier of evidence. These include time series, count-based models, and have broadly highlighted the detrimental associations between climate extremes and health at global and regional scales. At the same time, these studies cannot adjust for individual level factors or understand underlying nonlinearity in the associations, as well as the interactions between 2 or more predictor variables. As such, as a second tier of evidence generation, there is a necessity for individual levels of analysis wherein we can account or adjust for individual confounders. Study designs, such as randomized controlled trials, prospective cohort studies, case crossover studies, offer advantages in terms of being more reliable with greater internal validity. In this slide, I have highlighted some of the recent individual level studies related to temperature extremes and various health outcomes. Next slide, please. Next slide, please. Yeah. There is also an emerging individual level evidence of the associations between, say, flooding and various health outcomes, including psychological health, diarrhea, mortality, infant mortality, and pregnancy loss. Next slide, please. Again, there has been accumulative individual level evidence on the associations between wildfires and respiratory and cardiovascular health, or child mortality, and other outcomes. Various systematic reviews have consistently pointed out that most of these evidences have emerged from high-income settings, and there is relatively less evidence from resource-scarce, low and middle-income countries, and as such, the effects that we see today are most likely an underestimate. Next slide, please. It is very important to know that how health effects of extreme climatic events are socio-spatially stratified. For effective intervention towards mitigation and adaptation, it is imperative to know who the vulnerable population are and where do they live. Evidences have shown that climate extremes may interact with the characteristics of the population, such as age, gender, as race, socioeconomic status, employment type, to produce specific disparities in climate-induced health effects. For example, there has been evidence of solastalgia and climate anxiety amongst adolescents after extreme climate events. Population-level disparities may also originate from underlying pre-existing health conditions. With the increasing proportion of elderly in our aging societies, it is very important to understand how climate extremes may interact with diverse aging phenotypes. So in this slide, I've highlighted some of the studies talking about vulnerable subgroups wherein they have found significant effects in specific subgroups of population. Next slide, please. The interaction between person, place, and time to produce a specific socio-spatial distribution of climate-induced risk in a city is very important. Specifically, how does climate-induced risks interact with various attributes of cities and neighborhoods, their design and planning? There has been very little evidence thus far in this regard. Climate risks may interact with various urban attributes such as urban density, physical characteristics of the housing, blue-green infrastructures, air pollution, to produce specific effects on health. In cities with high vertical densities, such as Hong Kong or New York, urban heat island effects emerge as a result of high density, impervious spaces, and poor reflectivity of those spaces. Energy-intensive personalized cooling and waste heat generated may further aggravate urban heat island effect. On the other hand, a sustainable urban design with well-designed blue-green infrastructure can enable us to move from personalized cooling to more energy-efficient community cooling. Next slide, please. Mitigation and adaptation to climate-induced health risks will mean we minimize offset climatic hazards via cooling, creating cooling spaces by designing blue-green infrastructures, optimizing watershed management and sanitation. We reduce vulnerabilities through appropriate interventions for vulnerable subgroups such as elderly and infants, provisioning high-quality, affordable health care and insurance, and reduce exposures via hazard-proofing housing and our urban structures and creating early warning systems. A recent study led by our colleagues at the University of Hong Kong performed a spatiotemporal hazard exposure vulnerability assessment of extreme heat risks over a 10-year period by integrating cumulative very hot hour days and very hot night days in summer, population density, as well as a principal component analysis of the key socio-demographic characteristics. From the developed heat risk maps and the location of the existing 19 night shelter facilities, the study concluded that the existing support services are in the nighttime are rather insufficient in future in terms of distribution scope and their number. Next slide, please. As a third tier of evidence generation, there is also a need to collect data and evidence to understand what intervention may work in a given setting and what may not. Randomized controlled trials with experimental design constitute gold standards in scientific research. And as I looked through the literature, I found 2 RCT interventions with respect to climate. The Victorian Healthy Homes Program was an RCT and involved home upgrading intervention in 800 plus low-income housing to create warmer and drier indoor environments. The study reported that upgrade was associated with improved quality of life, reduced breathlessness, leading to an average healthcare saving of around $900 over the winter period. In a low and middle income setting, another ongoing study from rural Burkina Faso involves a 2-year community-based stratified RCT, implementing sun-reflecting roof coating known as cool roofs as a climate change adaptation intervention for passive indoor home cooling. The study involved 1,200 participants in 600 households across 25 villages and is currently collecting data on a range of health outcomes, including heart rate, blood pressure, body temperature, blood glucose, heat-related outcomes, and indoor climatic parameters. In a nutshell, I want to conclude by saying that global and regional level ecological studies constitute the first tier of evidence generation. At the second tier, more evidence is needed on the association and the causality from climate extremes to health and behavioral outcomes at an individual level of analysis. There is a need to collect reliable evidence on how climate-related health risks may be stratified by individual level and city level vulnerabilities for actionable evidence-based interventions. At the third tier, evidence is also required on the effectiveness of the various interventions, especially from low and middle income countries, which are likely to be disproportionately affected by these extreme climatic events. We may also leverage housing and urban renewal programs in the cities as natural experiments in order to understand which sort of intervention may be more effective. There is also a need to harmonize evidences from multiple settings, map different climate risks and associated health outcomes to carefully identify specific causal pathways to health and behavior. And lastly, knowledge sharing and transferability of urban interventions for climate resilience is also very important. Next slide. This is okay. Next slide, please. Thank you.
Thank you very much, Dr. Sarkar. That's a perfect segue into perhaps a few of my comments and I'll try and shorten that to actually less than 10 minutes. So maybe, Shanaik, we could have the final slides, and then I hope we'll have time for questions. So principally, our group has been working, and we're very pleased to have the collaboration with the National Academy of Medicine to look at how you could develop research priorities to understand the biology and address the impacts of climate change on vulnerable populations, particularly women and children. The next slide. Our work started largely from an initial exercise to look at a gap map. Next slide, please, which was to try and see what was available, particularly from low and middle income countries, in terms of evidence to address adaptation, to some extent mitigation strategies of climate hazards. And as you can see from the distribution of this heat map, there's very little in relation to the types of interventions that Chinmoy was talking about around behavioral, individual level interventions, or those that relate to the ecosystem. Next slide. We also tried to see if we could identify things that related to specific disease burdens or impacts, including things that related to pregnancy, birth outcomes. And you will find that for many areas, there was virtually nothing. And to our greatest surprise, in low and middle income countries, the kind of interventions that would address adaptation or mitigation for occupational hazards and injuries were virtually non-existent. And you would have thought that that would be an important group. To take this further, we were funded and supported to undertake a research prioritization exercise, taking these gaps and trying to put some specific questions around how we could go about addressing that. Next slide. And to do this, we assembled a group of people, and the first such workshop was actually held in Dubai last year. We were pleased to again have partnership from a range of agencies and organizations. Next slide. We assembled a group of about 30 people with a very specific purpose and premise to review a consolidated list of existing priority research questions that we had gleaned from the literature, and to try and seek input from experts within South Asia, Middle East, and Africa to understand how they prioritize those gaps in the context of their work and their environment. And the idea was to develop a common understanding as a first step towards looking at some of the big picture items in relation to climate change, particularly heat-related impacts on vulnerable populations. Next slide. As I mentioned, this workshop followed a stringent methodology where we asked people specific questions, provided the background information, and then asked them to prioritize those in relation to their own work and also their own understanding of the literature. And in the interest of time, let me just give you a snapshot of the kind of prioritization that was undertaken in this first research prioritization workshop. Next slide, please. So if you could see, next slide. If you could see, some of the top research questions that were identified, they ranged from things that relate to mental health priorities in relation to populations, particularly those of younger people, and also related to information that was not available around what could be done during pregnancy. And as you can see, there has been an exponential increase in some of the information that we have available. And you will see number 5, what could be incorporated within urban planning and city governance to reduce heat island impact and particularly climate change effect in cities where populations are generally clustered. And also importantly, looking at marginalized populations and particularly some of the gender inequities, you will note that we did prioritize questions that related to women's engagement in decision-making about environment and climate change management, mitigation, adaptation strategies. Following this exercise, this wasn't enough. There was a strong call and a desire to look at perhaps much more on the biological pathways. Next slide. And to understand some of the pathophysiological mechanisms in terms of how does climate change, particularly heat and its interface with environmental pollution, impact health outcomes. And to this extent, we held a workshop in December in Toronto, where we were very honored to have Professor Yao present a keynote address, and we assembled, next slides, close to around 100 top scientists from North America, Europe, and also had participation from the World Health Organization and Wellcome Trust in this. And in these 2 days of deliberations, there were a number of areas that were identified, and I don't have time to go through everything, but I'll just give you an example. Next slide, of the kind of studies that were put together in these learning sessions, looking at climate change, environment, air quality, its effect on agriculture, food systems, and nutrition outcomes. And I'm very pleased to tell you that FAO has actually followed up with some of that work with a workshop being planned in June. The role of omics, epigenetics, microbiome, and other climate change research that relates to some of the pathophysiological mechanisms that may be actually common across the world. And of course, as you heard from Chris, the role of big data analytics, remote sensing, and AI in climate change research. And you will note that key discussion questions in all of those were, what are the vulnerable, understudied, marginalized populations, and what are the measurement challenges, and where could we develop partnerships between high-income, middle-income, and low-income countries to address some of these questions together. Next slide, and I think that is potentially my last slide. This is just an illustration from one of the omics group in terms of how do you identify biological pathways for resilience and vulnerability? What are the technologies and tools that may be available to us in terms of doing this? And how could this be done in a cost-effective manner through collaboration between countries living in the proverbial north or high-income settings and countries that are dealing with some of this. And the last point you see over here as a number 5 is, how do you build capacity through this partnership and collaboration in various aspects? So I'm going to stop at this, Shanae. You could stop sharing the slides because we have just about 20 minutes or little under 20 minutes left. And I'd like to give an opportunity to our panelists to answer some questions. And maybe I can start with you, Chris, if I may, with the first question. And there is a question from our participants. But let me ask you a big important point that relates some of the impact of extreme heat climate. Perhaps you can take the slides off so people can see everybody. And the impact on migration, food security, and other patterns is the effect on food production. So you talked about food security, but what is the state of the art in terms of what we know about not just green zones, but actually food production or agriculture, and not only that, on animals? What is happening to broad One Health in these kind of environment?
So a few comments, and then just to frame that, definitely not a core expertise of ours on the food, but we've looked at some of the data. As you probably know, global population in the last 70 years has gone up, more than 2.5-fold, and food production globally has gone up more than that. So that food availability, or calories available per person, has continued to grow, including during the 40-year segment from 1978 to present, where global mean surface temperature has been going up in a straight line, right? So, at the global level, production is ahead. If you look at the country level, caloric availability has at worst been sort of flat, maybe gone down a little bit during sort of social crises, but not really. Even in the Sahel, there hasn't been real declines. And so I think the food insecurity part is much more focal, right? It's in those very heat-stressed environments and less for whole nations. And we do see in the data the absolutely critical role of the World Food Program and other food flows flowing in to keep that caloric availability high, right? Because it's telling you about the net availability of food. And so that's been a huge issue, a huge factor in avoiding famine and food insecurity, extreme forms of food insecurity. And so when we look at these forecasts in the future, which also suggests that food availability will keep getting better in aggregate, you do have to remember that that's conditional on things like the World Food Program continuing and filling that vital gap. In terms of specific impacts and specific crops and specific animals and chickens, egg production, there is a literature out there. There's a real, things like NASA Harvest have done a lot of good work on using satellite imagery to track coarsely production and avail of different crops, and a little bit less sophisticated on animals. And I think there's a big scope to use satellite data as it gets better and better to do that in a more robust way. But it's not something that's been, other than the NASA Harvest sort of coarser level, hasn't been done on a routine basis.
Thank you, Chris. Well, let's move on to, and I'll come back to you, but let's move on to Dr. Holloway. I mean, fantastic presentation. One of the questions that has been posed by our participants is in relation to incarcerated individuals. And is there any data or information on injustice, climate injustice, perpetrated by the consequence of our industrial prison complex?
That is a really good question. And, I think that there's a lot of threads that you could look at about, access to air conditioning and access to disease. When it comes to air pollution, I think it falls into the category of a lot of vulnerable groups where we may not know what's happening at those facilities. And I have not seen any research that is focused on that. And of course, you have both the outdoor air and also indoor air quality. I think more and more studies are being designed to look at individual vulnerable groups, like whether it's kids in school and understanding what is the air quality near schools, or in disadvantaged communities, or in your example for prisons. But I think that there's more and more studies that are being focused on the communities and what their risk factors are, which is a little bit of a shift, because I think historically there's been more of a focus on the sources of pollution. What do we know that's coming from power plants or coming from highways? And now I think both are different ways of framing around the same question, but I'm not aware of any research that's been done with a focus on prison inmates. No.
Thank you. Well, let's move to you, Dr. Sarkar. There's a lot of food for thought in your presentation, but I wanted to ask you, in the quest for looking at urban planning and some of those designs, in rural systems, when we do our work in climate and environment, we are often reminded by people that modernization has also been one of the biggest culprits in terms of certainly making some of our health facilities, for example, less climate friendly with low ceilings, air conditioning, things which are extremely energy intense in terms of consumption needs, and also impossible to use traditional methods to cool those areas. So the concept of high ceilings, which was there in the colonial period, used by the British with ventilators near the ceilings, and therefore a possibility of getting hot air out. Those things don't exist anymore. So is there a stream of work which looks at planning, particularly design, using some of the traditional methodologies and learnings from the community?
That's a very good question. I think, of course, yes. So because we actually take cues from the history, and basically from our studies, for example, we have found like densification, the economy of scale. So that's a double-edged sword. So urban densification, there are some very good attributes of it, right, in terms of accessibility to facilities, healthcare, and so on. But at the same time, we have sort of negative attributes in terms of pollution, in terms of congestion, which adversely affects, say, our physical activity and eventually our health. But I think, yeah, we have, of course, most of these concepts like urban greening and how to design green spaces, they always emerge from what have been done previously, centuries back. So the concepts are there. And so when we talk about green spaces, of course, it emerged from the 18th century. And if you are talking about sort of within building designs, yes, of course. However, like when we sit in cities like Hong Kong or New York, where space is very limited and very expensive, right? So then it's a matter of balancing, like how can we make these high density cities more sustainable by using those concepts and sort of leveraging on them.
Well, thank you. Yes, of course, indeed. And I'm reflecting on some of the wind catchers that used to be traditional in many parts of the world, particularly where dry heat is common, and they've disappeared. So maybe there is some food for thought in terms of looking at architectural strategies that were traditionally used for cooling and may have disappeared with the advent of modern systems. Chris, I wanted to ask you, with the phenomenal improvements in remote sensing and AI data analytics, what is the state of what do we currently know about the interface of heat and air pollution? Are the effects additive, multiplicative in certain settings? We're certainly looking at some of the effects in pregnancy of heat that have been very much in the news. And when I reflect upon women living in some parts of the world who are exposed to indoor air pollution, I mean, they also have similar kind of impacts from the air pollution alone. So are those effects, a double whammy in some of those circumstances, or should we not worry too much about this?
Great question. From a practical modeling point of view, people have either not controlled for air pollution in the direct heat risk curves, or they've made a multiplicative assumption, but that's a rarity. And likewise, on the air pollution studies, I don't know of any that have directly, in coming up with the risk curves, controlled. So an important area that needs more work in the GBD, we sort of presume they're multiplicative in the way we do our analyses, but that's an assumption, not particularly backed up by
based on empiric data. Well, that's a very important point, and perhaps a pointer towards prioritizing some of that work. Tracey, I wanted to come back to you because your presentation focused on the United States, but I've been reflecting also on how some of those points are extremely relevant to the global South or low middle income countries, where vulnerable groups may not be visible at all in terms of climate vulnerability and outcomes. So please give me a sense from your work and some of the implications thereof as to how this can be explored a little better in terms of targeting and interventions to reach the most affected, impacted, vulnerable populations.
Thank you. Well, I think that, with this panel's focus on research needs, that is a really perfect segue because all of these issues, many of the papers that I pointed to in the latter part of my talk were published this year or last year. I mean, this is a very rapidly evolving area of research in the US because we have new data from new models, new satellites, and new networks of low-cost sensors. But the good news is that while the monitoring data is local, the models may be transferred to other areas, and the satellite data is usually from global satellites. So as we're finding take-home points of where these data can be applied to have health relevant, decision relevant, equity relevant outcomes, I think that many of those analyses are directly transferable to other parts of the world. And I think a great example is the value of nitrogen dioxide data from a satellite called TROPOMI. And TROPOMI is a European instrument. It was launched in 2018, so we've had data available since 2019. And that instrument circles the entire globe every day. So we have snapshots of the whole world every day for NO2. One of the issues is that NO2 is not usually at the top of the list of health relevant pollutants, but there's been a lot of research, one, on the health impacts of NO2, and two, using NO2 as a proxy for exposure to fossil fuel burning. So I think this idea that we have this global, daily, free data set that can be used anywhere and has been shown to identify neighborhood to neighborhood inequities in the US, where we have more monitors than most countries, I think is a nice example of a methodology that is directly transferable, but that work is really just beginning.
Absolutely spot on. And I think there is also a need for exploring how the cost of goods, particularly some of these monitoring sensors and weather stations, can be brought down. And I'm sure the technology can be made a lot more accessible. So we have time for one more question. I'm going to pass that to Dr. Sarkar. So as a unique and perhaps one of the first National Academy of Medicine Hong Kong University Fellows, I want to give you the floor to maybe say something about how can we jumpstart and boost global capacity in terms of research, scholarship, and work in this area, because currently the number of people who have true methodological expertise in addressing climate change solutions, mitigation, and adaptation are extremely limited in low and middle income countries. Even in South and Southeast Asia, the numbers can be counted on fingertips. So Can you say something about how this could be approached?
I think I go back to the previous sort of discussion. Basically, one of the challenges for low and middle income countries is having good data sets. So how can we have sort of reliable data sets? And that's one. And where are the data sets that are less expensive and affordable, right? So that is because the research funding in low middle income countries, when you compare it with the high income countries, will be much lesser. And second thing is about training, modeling. How do you train people to sort of study modeling and the technicalities of it? So that's something I think from my career experience, I think that's something very important, especially in terms of knowledge sharing and transferability of that knowledge to from, say, high-income countries to low middle-income countries, and how we can have sort of collaborations between institutions for training up the next generation of climate scientists and urban modelers. So that's the second important point. And of course, we have AI. We do have various sets of data sets which are less expensive, but some of them are even free. Like we have OpenStreetMaps, we have different types of satellite data. If we want to measure greenness, if we want to measure accessibility from a street network, we can have it. So again, the how to access it, that's something our sort of colleagues, the low middle income countries may not know. So the creation of a sort of resource that can be accessed, sort of repository, that can also help a lot.
Well, thank you for that thoughtful answer. Well, ladies and gentlemen, this has been a phenomenal session, and I've been very privileged to moderate this. Let me try and close by saying that to some of us who've been in the business of global health for several decades, we are at the cusp of the emergence of science and science-based solutions that will come out in the area of climate, environment, and human health and development. A bit like what we did with INCLIN some decades ago. We created the global network around clinical epidemiology and capacity development. And I think on climate, enormous opportunity exists for collaboration, networking. And rather than I close the session, I want to give the floor to Victor because I just saw your hand up. Victor, do you want to make some closing remarks as we finish our session? Thank you.